Good morning, good afternoon, and good evening, everyone. My name is Steve Kenei, and I'm an GIS and Information Management Officer at the American Red Cross, based in Nairobi, Kenya. And I'm here with my colleagues. Over to you, Sheila.
Hi, everyone. I'm Sheila. I'm Information Management Officer from IFRC Indonesia, based in Jakarta.
Hi everyone, my name is Anggi Ardiyansah. I am a social and health and social service staff in PMI and especially in CP3 coordinator.
Hi everyone, my name is Tino, working as a GIS consultant to support the implementation of CP3 in Guinea.
Okay, thank you everyone. Before we break down what CP3 is, I think it's important for us to revisit the purpose of this talk is, and what we are attempting to do is showcase case studies in Indonesia and Guinea on the use of open source data to support COVID-19 response in those countries. And we hope that through this talk, you will be able to pick on some of the best of our practices and adopt them to your own country context. So that is the main goal of this talk. So let's move over to the next slide, Sheila, as we discuss a bit more what CP3 program is. So what is the CP3 program? Launched in 2017 with funding from USAID, IFRC has been supporting national societies, strengthening the ability of communities and the national societies and partners in 8 countries to prevent, detect, and respond to disease threats and play a significant role in preparing for future risks. CP3, while different in each country, it has been designed to be adaptable and based on country priorities and needs. And at the moment, the program is ongoing in 8 countries, that is Indonesia, Uganda, Cameroon, Kenya, the DRC, Sierra Leone, Guinea, and Mali. And for the purposes of this talk, we are going to be talking a bit more in depth about what has been ongoing in Guinea and the Indonesia. So CP3 program is divided into 3 primary work streams. So work stream 1 involves working with communities at risk and building the capacity to detect and report potential epidemics. And work stream number 2 focuses on improving the capacity of the national society to respond to epidemics and to contribute to the national health security in general. And work stream 3 focuses on engaging with private sector and other key stakeholders in managing and preparing for epidemics. So under work stream 2, we have a component that we call data readiness. And in the Red Cross, Red Crescent movement, data readiness is the ability of national societies to use quality and timely information in humanitarian response and in humanitarian program design. And this is, data readiness is broken down into 3 primary areas. So 1, data preparedness. Here we are talking a lot about acquisition of data, and then data literacy, interpretation, building the capacity of national society and other stakeholders to interpret the data. And through that, the 3rd component now, data-driven decision-making, you're able to make evidence-based judgments. So under the data preparedness component, and specifically looking at acquisition of data that is going to be used to inform decisions, we have been working a lot sourcing secondary data assets and have developed something we are calling the data grid. So the data grid basically it's a repository of data sets that we thought are relevant if you want to, understand risk at community level and, be able to really pinpoint geographically where those risks are. So we've broken this grid down into 4 specific categories. So 1, geographic. So here we're talking about GIS spatial data sets. So we're talking about administrative boundaries, population by geographical points. We have risk data as well, and socio-cultural data, and also data that is collected from national society. And this data grid is publicly accessible, so it's publicly available and open for everyone to use. And we're also advocating quite a lot for the use of humanitarian data exchange, the HDX. Most of the data sets, actually all the data sets that we have sourced through the CP3 program is shared on HDX. And we are also big advocates of using OpenStreetMap and building on the data sets already available via OpenStreetMap. So we have we've collected, from the previous slide you've seen, if we have repository of secondary data that we've sourced from elsewhere, but then we also have a component of field data collection where we go to community level to fill some data gaps at a very fine resolution, and also train the communities on data preparedness as well. I am now going to hand over to Tino for a case study on CP3 and COVID response in Guinea. Thank you very much.
Thank you, Kenei. For the CP3 Guinea cases, when we were about to start the project, so we faced a lack of information about the community where we were implementing the project. So one of the first things we did is to call the National Society, the local OSM communities, and the civil society to work together to map the unmapped communities. And that activity was done through mapathons, where we had to map 12 sub-prefectures of the region where we were implementing the project. A total number of 53 mappers joined the mapathons, and at the end of the exercise, we had 79,000 buildings added to OSM, and we had also 7,000 kilometers road added to the map. So each task covered an entire sub-prefectures. The process of using the task was very useful because it enabled the project to monitor and to validate the features that was mapped. And at the end of the process of remote mapping, all the features mapped, I mean, the road network, the buildings were added to OSM and are actually available to anyone. So the support of CP3 to data readiness also covered the COVID-19 response in Guinea. Because in the early weeks of the COVID-19 outbreaks, the health partners asked for the map where we have air, earth, and sea entry points in the country. So the map was created using the data we made available as part of data readiness activities, and the map helps all the partners to prepare the deployment of the volunteers of health workers across the countries to produce the map using vulnerable communities across the country. The key features we mapped were the health facilities, the border crossing points, the security force location, and the capacity of these health facilities. We wanted to know how many doctors they have, how many nurses. So do they have access to electricity? Do they have access to water sources? And all this data is now currently available on OSM and also published on HDX to help humanitarian workers to get access to them very easily.
Through the CP3 program, Indonesia Red Cross or PMI has continued to support the community and stakeholders in Indonesia to prevent, detect, and respond to disease threats and play a central and significant role through several strategies. And one of them is the data readiness preparedness strategy. At the community level, PMI encouraged data utilization to improve community preparedness for epidemic and pandemic events through several activities such as train community-based surveillance or CBS for the community preparedness in detecting health risks. The community is trained and prepared with tools to report any potential risks in their area. From 2018, PMI and IFRC have piloted CP3 in a total of 8 villages. And now we are in the process of scaling up to 16 other villages in Indonesia. Secondly is prepare village risk map through community mapping and determine baseline on village borders with the community to estimate the number of samples for sampling design and activity development. And also for preparing first responders in the event of epidemic and pandemic outbreak, PMI prepares a data system to support quick response, such as setting up, updating, and encouraging utilization of secondary data storage for data preparedness that can be utilized to support response activities. And also training the internal PMI and also the community to become the first responder for epidemic events. And importantly, to support the preparedness and response activities, PMI also actively engage relevant stakeholders through several activities, such as utilize the knowledge, attitude, practice, or KAP analysis for program development, advocacy, and engagement with internal PME and government. And also PMI also collaborated with government and community stakeholders in the targeted area using data as an advocacy tool. And lastly, be part of a collaborative network with local, national, and international entities and contribute to open data such as OpenStreetMap and humanitarian data exchange.
Thank you, Sheila. For the next slide is implementation. And to support the three main outputs of data readiness, TOC, data preparedness, data literacy, and data-driven decision-making, PMI first strives to strengthen the data culture and build knowledge capacity. In 2018 and 2019, PMI collaborated with Perkumpulan OpenStreetMap Indonesia, or usually we call POI, held 2 sessions of mapping training for PMI staff and volunteer. The aim was to strengthen GIS and mapping skills by using OpenStreetMap, QGIS, and data collection tools. After training and TOT, PMI started to run community-based surveillance or CBS and participatory mapping in 8 target villages. Each village can build their maps containing infrastructures, vulnerability, and area capacity, and also send alerts for suspected disease in the community. The local government has used the maps during the COVID-19 response. As a result of data literacy development, PMI currently possesses the skills and capacities to collect, process, interpret, and use data for decision-making. In April 2020, PMI, including Health and IT Bureau, collaborated to develop maps and provide recommendations of areas that needed the COVID-19's early response in Jakarta region. This map is an implementation of data-driven decision-making in PMI management. You can see on the screen, and significantly, PMI has developed the capacity to set up and conduct CBS and collect alerts. When the COVID-19 pandemic hit, PMI scaled up CBS implementation to 316 villages with a simplified system as a part of community response. After collecting the data using Kobo Collect by village coordinator and PMI area representative, PMI visualized all data into a Power BI dashboard, aiming to be utilized as an information source for decision making. And the information is also reported to the government. For the lesson, we have 2 points of lesson learned during CP3 implementation in Indonesia, and it's usually useful for COVID-19 response to the national societies group that the Indonesian Red Cross or PMI developed its ability for data-driven decision-making for community preparedness for epidemics, pandemics, and has started to use its modalities for COVID-19 response in CP3 and another areas. Secondly, engage community response to COVID-19 and future pandemics. Volunteers in CP3 target area adapt faster and engage more in COVID-19 response by sending alerts through the CBS system for early case detection. A system developed by implemented by PMI to support the government as auxiliary. And the trained volunteers also became facilitators to another village. And next slide is the next step or the next plan. Okay, our next step is the first one is updating spatial data and map for health emergency. And then the second one is updating curriculum for community risk mapping. And then the third one is updating secondary data storage to support future preparedness response activities learning from COVID-19 experience. And then the last one is utilizing and managing health data emergency for decision making. Okay, that is from my presentation. Refer to you, Steve.
Thank you very much, Tino, Sheila, and Ang, and everyone else for joining us today for this presentation. And we look forward to your questions, and feel free to reach us through the contacts provided at the end of this slide. Over to you for questions.